Our next guest has worked with an extensive network of parliamentarians, health professionals, and community leaders to uphold health and social justice in the Philippines and across the Asia-Pacific region. Joining us now from Manila is Ramon San Pascual, Executive Director of Healthcare Without Harm Asia. How is the climate crisis, Ramon, contributing to poor air quality in the Philippines, and why does it pose such a serious threat to people's health?
No, you're supposed to get the studio camera.
Hi, Jamil. Good afternoon from Manila.
Thank you.
Philippines is now the third in terms of having the worst air quality level in the world, next to China, next to Mongolia. And in the Philippines, we are quite, people are familiar with that bad traffic situation in Manila. And this is real. And this is made worse by the fact that we are so dependent in terms of our energy that runs our cars, that run our homes, our industries, derived from fossil fuel. And without proper regulatory laws being implemented, the severity of air pollution has only gone from bad to worse every year. And the trend towards urbanization, high growth of our population contribute to the worsening air pollution. And this indeed, in a way, drive further human activities. And without proper rechanneling from which our energy is being sourced, then it just makes the climate even worse, even pushing the level of air quality to a lower level. And again, without proper implementation of the law and reviewing of air quality standards, then air pollution gets severe, impacting particularly among children, pregnant women, and the elderly. And this is quite sad. It's both a problem of our condition and environment, but that makes people suffer in terms of various illnesses coming from terrible air pollution.
Specifically at hospitals, what is being done to improve waste management of mercury, lead, and other harmful chemicals?
Healthcare Without Harm has been instrumental in addressing the harmful use of mercury as one hazardous form of chemical. Over the past 20 years now, I'm not only talking about the Philippines, but I'm talking about our mercury campaign that was done globally, that led to many regulations, even in our own country, in the Philippines, that finally eliminated and replaced the mercury-laden equipment and devices, such as thermometers, and even those devices being used to measure blood pressure. It's now legally, you won't see that anymore in hospitals in the Philippines. And yet, as an Asian organization, we continue to campaign on this because there are other Asian countries, particularly in rural and remote communities in certain places such as Vietnam, that still rely on mercury devices being used in hospitals and even in homes. And we know that mercury, the moment it is released from Earth, you can no longer put it back, and it gives its harmful effect both to the people, to the atmosphere, and even to the soil. So mercury is a good campaign in Healthcare Without Harm as we consider it, but we continue to work on other harmful chemicals being used in hospitals. We cannot keep on saying that hospitals heal its own patients if it's still able to rely on harmful chemicals as parts of its operation. But it happens, and we are addressing this. And the way to address this is to, one, to communicate to the health workers and the leadership in hospitals that there are indeed replacements. Secondly, to tell them how to handle it properly in case there is a spillage. What are the proper procedures and the proper steps. But third, and we think this is the more powerful intervention that can be done, is to engage into sustainable procurement, as we call it, by addressing the supply chain that keeps in and supplying the harmful chemicals and replacing it with alternatives that are safer and can even be cheaper, especially if it become mainstream. Then we are able to eliminate gradually hospitals' use of harmful chemicals.
What can be done to better manage the use and disposal of plastic within the healthcare sector?
This is a very relevant question nowadays. Again, I love my country, but I must also admit that Philippines, together with Vietnam and China, are among the top 5 marine pollutants in the world. That means we contribute significant amount, not only of regular waste, but sadly, plastic waste into the marine litter. And we did have an audit completed over 6 hospitals in Indonesia and the Philippines just recently. And it was found out, would you believe, that of the total waste output in a given day in these 6 hospitals, at least 50%, it can be 55, 57, 60% depending on the hospitals, that is composed of plastic. Considered as hospital waste, but more than 50% is plastics. And these are used for food packaging, for medical packaging, medical equipment and devices, and even what we call as the sanitary napkins or those being used by children as pampers, the young infant. These are made of plastic that end up as waste. And what is also quite unbelievable is that many plastic bottles are found in the waste bins that are supposedly infectious. These are the plastic bottles, or what we call as the PET bottles. Now, the hospital administrators, doctors, are shocked to find out the results of the audit. So there are at least 10 key things that we resolved to do, together with Healthcare Without Harm and the hospitals that were audited, and we are now disseminating the results of this plastic waste audit in these hospitals in the Philippines and Indonesia. And among the immediate steps that the doctors themselves have realized they must do, one is to begin getting rid of the single-use plastics. It's either to minimize or ultimately take away plastic bags, the food bags that are being thrown away after being used. Even PET bottles, the reality of these PET bottles, even if they are recyclable, only 10% go to the recycling process. The 90% of these plastic bottles we use for storing our water or even our cola drinks would end up in the soil, in the river, would float onto our Manila Bay, and we are very near now. This is studio near Manila Bay, and so the doctors decided that to discourage the personnel, the staff, the nurses, and the doctors from relying on their water from the PET bottle itself or the plastic bottle, one, they will provide the reusable bottle. The administration of the administrators of the hospital. Secondly, they will place water stations across the strategic places around the hospital so as people will have the place to get and reuse or refill their water, and without relying again of buying the plastic or the water from plastic bottle.
Wonderful.
The other things being done in the hospital is to introduce other ways of packaging that will minimize the use of plastics, even in the medical supplies. And the third is to educate.